Hello guys, I'm Jonathan, and since COVID-19 came, actually we have not been having peace. As you can see right now, wearing a mask is kind of, you don't feel comfortable with it. Sometimes you feel hard to breathe, and also it causes some pains in the ears. So it has really affected us. We cannot walk freely because we are fearing being caught by the police and the men in uniform. Yeah, and also we are afraid of the disease. We don't know who might be having it, because sometimes when we remove the mask, you don't know what you have just touched or whatever the place, whether it was contaminated. So it's really affecting us. Thank you.
It's Mbata, and I'm wearing this because I forgot my mask. Right now it's very dangerous to walk without a mask because they are putting people in. If you're found without a mask, especially with the government, the police will put you in, you put in a cell and they'll fine you. Sometimes they move you to court, and life has not been so easy because moving around is not easy. Sometimes you forget it, you don't have a hanky, you don't have anything, so you're forced to give some money to get a mask. Sometimes you don't have even that money and it's a bit challenging, and it's not so easy because you find that even the people that are doing their small businesses, it's really affecting them. The people that are doing hand-to-mouth work, it is very challenging because it's either you must have a mask, so you're torn between buying the mask or getting the food. So it's clumsy. It's really clumsy. It's not easy, but we hope all will be well.
Okay, so that was the brief video we had to show. So now I will hand over the floor to Rainer to give our opening remarks.
Dear colleagues and dear friends, it's really a great pleasure It is really a great pleasure to have you with us at this webinar, and I'm happy to say that we are also discussing now the impact of COVID-19 on peace processes in Africa. I think it is needed to say that the pandemic during the last year has changed quite everything, but not one point. The militaristic development in the world is continuing, and we are waiting for the new figures of the Swedish Peace Research Institute, which will be announced on the 26th of April. And I think it is not too much to say that they will announce that the world is spending $2 trillion for military purposes. And you know this better than me. What are the consequences of these military spending? Hunger, poverty, no schools, no healthcare systems. And that is the reason that it is absolutely needed to discuss what the COVID-19 pandemic also means for the peace processes. And it was, I think, a great achievement that the UN General Secretary Guterres announced and asked for ceasefire in all conflicts in the world, and said pandemic forced us to stop the wars. The consequences you can see, we have even more wars and conflicts in the world. So the world is not following the United Nations. And this means we need more actions and activities of the social movement and the peace movement for overcoming conflicts and wars and for coming to a process of peace and disarmament. And I'm very happy that we today get an overview about the conflict dimension in Africa, to get a deeper understanding about the conflicts, to develop more cooperation between us, and to bring all the results of our work to the IPB World Congress in Barcelona at the end of the year. Reimagine is the slogan of the conference. Reimagine is imagine after 50 years of the song, of the famous song. And I think it is very important that we are putting all our thoughts, all our ideas, all our visions together and come with a big of hope to Barcelona to create a better world in peace. And I hope this Zoom conference will be a small part of bringing facts and arguments together for our fight for a world without war and hunger, for a world in peace and development. Thank you so much for joining us today. Thank you to all the speakers in the name of IPB for giving their presentations. And I think it will be a good start point for future and further activities. Thank you.
Thank you very much, Rainer. So we will just move straight on to our first speaker, which we have reorganized the order because some people have had some trouble, or our speakers have had some trouble getting into the room. I can see some more people are still having trouble, but we'll try and resolve this for them. So we're going to hand over to Tyson Berry Smith Jr., who's part of our Africa Working Group, and he is the founder and director of the NGO for Kids International. So over to you, Tyson.
Good afternoon to all. I'm Tyson Smith Berry Jr., Executive Director of Kids International. Today, I will be speaking to you on the topic, the impact of COVID-19 on peace processes in Africa. As we all know that the global spread of COVID-19 has drastically disrupted our way of life. This impact is mostly felt in the fragile context where a combination of prolonged armed conflict, bad governance, human rights, and inadequate health systems has predisposed this nation for more devastating effects of the pandemic. COVID-19 has erupted some of our peace-building gains made in Liberia over the last decade and a half. The threat posed by COVID-19 in sustaining peace in Liberia has increased the need to strengthen regional and sub-regional collaboration and international collaboration to contain and mitigate the impact of COVID-19. While this virus is posing multitude of challenges to Liberia peace and security and undermining social cohesion, it has provided opportunities to work collaboratively to address the conflict factors, including attending some of the root causes of conflict in this context that we as peace activists continue to advocate to address new conflict issues and trauma, as well as women and youth-related issues exposed by the virus. There are some issues that actually we as Africans, to be specific, Liberia, were affected during the COVID-19, and they show that in many instances, effort and resources have been swift from these activities to that of COVID-19 pandemic. First, we look at the issue of sexual and gender-based violence. During this period, the lockdown measures have increased the risk for women and girls who are raped at home with abusive parents, guardians, and that of partners. During the COVID-19 lockdown period, reports of rape and other forms of domestic violence have increased and now account for 5.5% of the COVID-19 related cases reported from community across the 15 countries in Liberia. The figure is believed to be underreported due to the agreement reached between the perpetrator and survivor family and travel restrictions imposed by the lockdown, which restrict the movement of our volunteers across communities to see as to whether these facts can be gathered for reporting to the national security agency that are responsible for such. We also have issues such as misinformation. When it comes to misinformation, the denial and non-compliance attitude are still common across community, which progress has been made to increase community knowledge on COVID through awareness and distribution of material. Many citizens are still in a denial mood or in a non-compliant state. An increasing rate of misinformation have the potential to spark violence and public unrest. Approximately 30% of Liberians are not complying with the government control measure, which suggests a level of distrust and public confidence between community or ordinary citizens and their government. This is a problematic for an effective response to the crisis. We also have this issue when it comes to community resistance and resilience. The government plans to provide a similar package, specifically including race and other items that target vulnerable communities. Community resilience requires powerful social capital and robust network that can facilitate collaborative and conclusive decisions and actions. Thousands of women, men, and children need to actively contribute to community resilience based on their individual capacity so that their collaborative efforts can contain a preventive and prevent the virus from spreading. So these are the issues of community resistance and resilience. Then we come to the issue of land dispute. Land dispute has been one of the cardinal issues in Liberia, and this issue has been a long-term conflict for us. So the COVID-19 has put a lot of stress to this issue of land dispute in Liberia when it comes to the boundary issues. And while land dispute and boundary harmonization cases remain unreported, even a single incident could degenerate into violent conflict and impede local peace and sustainability. Currently, a report by early warning volunteer and county authorities, there is an ongoing land dispute and boundary harmonization crisis in Lofa County, Nimba County, Grand Jide, River G, etc., etc. Involving the land crisis, we have intervened through the Ministry of Internal Affairs before it escalates into violent conflict and undermines the COVID-19 containment measure. So we have intervened in such activities so that this issue cannot erupt into a system that will undermine the COVID-19 measure that is taking place into our country. So we have worked to reconcile issues
and put it at rights. And I also have some recommendations I made for such research. We came up with some recommendations. These are my recommendations. From the data collected and analysis generated, Focus has recommended that the government should urgently implement its food distribution initiative across the country without further delay, which may actually put threat to the peace-building process in Liberia, while ensuring transparency and accountability, integrate and support early warning and social cohesion intervention into the national COVID-19 response plan, and adapt a post-pandemic resilient program and strategy that consider the complexity and systematic risks presented by the virus, rigging into the institutional reform. We also observe that recommendations like strengthening the capacity for reporting and preventing of sexual and gender-based violence, and promoting multilateral and soft collaboration approaches to contain and mitigate the impact of COVID-19 in Liberia and Africa at large. So we have also put into place that all of our volunteers to have a son to area that have the high risks of violence against women in this post COVID-19 period, so that they can be able to report on issues that is not being reported by parents who have who have the belief that they can handle this through family needs or whatsoever. So on this note, we have come up with this recommendation so that we as peace builder can have a cohesive and multilateral cohesion into our society, Liberia as well. I thank you all and await question to answer at the end of question and answers part of this webinar. Thank you ever so much.
Thank you, Tyson. That was really, really great. Some really great points there. So we will just move, I think, straight on to the next speaker that we have, which we have Lawrence here. Lawrence, I know you said that you had some technical difficulties. Do you, have you managed to resolve these? Do you think you're going to be able to speak?
Yes, we have. The people are in now.
Okay. Sorry, who was that? Was that Matt or? Yes. Okay. So we have Lawrence. Is Lawrence still in the room, or did she get kicked out? No, Lawrence is still here. Lawrence?
Lawrence is in the room, but it doesn't seem like the microphone's working.
Just ask that she unmute.
Hello.
There we go.
Hello.
Hi. Hi, Lawrence.
Can you hear me?
Yes, we can.
Okay, please. I've had some technical issues.
No worries.
Okay, please. I'm using the phone, and I don't know if the quality of my voice is.
No, we can hear you fine.
Elizabeth, you have only to mute yourself.
Yeah,
Can you hear me, please?
yes, I can hear you now.
Yes, we can.
Okay, please. Okay, as I said, Stefan, out of the office, I've an issue at the last minute, and I'm not with my presentation, but I will try to make a summary of what I had prepared for you. So my presentation, the impact of COVID-19 on peace building, I've just developed it in some 4 points. The first one was on social cohesion. And the point was that with COVID-19, it has shaken the foundation of society in regarding to people's way of living, the things that used to bring people together, like social gathering, like dialogue, community dialogue, they were not possible during this pandemic. And as many of the work in peace building and social cohesion was about bringing people together around those community dialogue, community gathering, this has affected peace building effort, especially at community level. And the restriction of gathering has had impact also on the work of peace builders. Because some of them, they were not able, this was one of the point of finding many donors, because COVID-19 have become a priority. And for some, peace building is no longer a priority. The priority have shifted to peace process, peace building, to COVID, and all measures to fight against COVID. This was also on aspect of findings, and as we know, many local NGOs and interview actors in peace building, they rely on external funding, and with COVID, it was no longer possible. And the future, especially when we look at the offer of donor, it's not many. This is also another impact. You have also, COVID have contributed to have increased the level of poverty in many of our communities. And we used to say that poverty is it's at the root of conflict. And as COVID has impacted in the economical aspects on some work, people losing their job and everything, there is increase in poverty. It in return affect the peace process, the peace building efforts. But also on domestic violence, COVID-19 has increased the level of domestic violence with lockdown. You have witnessed an increasing number of cases in domestic violence. We have increased with, especially to women, we have witnessed gender-based violence, but also violence with kids that should not attend schools. There have been an increase in family and domestic violence. But also they have, COVID-19 have also had impact on, what can I say, have had impact on mental health, especially for people who were already affected. You know, with peace building, the aspect of healing is a key aspect of peace building. And the isolation, the lockdown has increased the number of the trauma challenge that some of society already have faced. There has also an issue that was on trauma healing and mental health in general, especially for the people who were already affected. But also in trust between, may I say, leaders and the population. You know, when we talk about what we call normally vertical reconciliation, the reconciliation between the community and their leaders. And then because of some restrictions, some measures to fight against COVID, some communities felt that the government was exaggerating. There was an increase in distrust between leaders and the community. So in brief, as I said, I don't have my presentation. That was brief what I had prepared, and I had an emergence of something urgent at the last minute, and I just make the summary of my presentation. That was not really what I had prepared. I have to apologize. Thank you.
No problem. So you did a really great job considering you were not in your office and you didn't have any of your resources with you. So well done. We still don't have all of the speakers online who we had lined up. But the next person who we do have one other person who is also online, and this is Elizabeth Wenjuru.
Yeah.
Elizabeth, would you like to go next?
It's okay. It's okay.
Perfect. Okay, the floor is yours.
All right. Like you heard, my name is Elizabeth Wanjiru from Kenya. And I also have a short presentation. I had done a video before, like 2 videos of 2 interviews, and I sent them. And I guess you guys have them. But I'll quickly go through my presentation
Just
on
quickly,
the impact.
Elizabeth, just quickly, you have a presentation. Would you like to show it?
I guess I send it through Ernest. I send it to Ernest. He's supposed to have submitted it to you. I didn't send it to you directly.
Okay, no, I haven't received anything from Ernest, and
maybe he will give it to you later. It's okay.
Okay,
but
that's okay.
I can't continue.
Stefan?
Yes.
Yes, I'm here. I sent you the videos by email.
Okay, no worries.
And yeah, yes, those videos and the pictures from Ghana, the video from Kenya. I sent you an email. I guess you've got.
Okay, no worries. You just continue on, Elizabeth, as you were.
Yeah,
Right.
thank you so much. And thank you so much, Ernest, for forwarding the videos for me. I'll talk about the impacts and of the processes that have affected peace brought by COVID-19. And I'll start by the processes slowing down. Every process that has been happening in the world and even in Africa and in Kenya, to be specific, has slowed down. There's no communication, there's no travel, everything is just slowed down, which has brought a lot of confusion and a lot of fear and uncertainty. So the processes have just slowed down because of those factors, and in result, there's a lot of fear, there's confusion. People don't know what is happening, when this will end, how it will end, the uncertainty of tomorrow, whether someone is gonna die or not, and the fear in general of not knowing what is happening. The second point is on public gatherings. There's a ban on the public gatherings, and we know mostly Africans, we are interconnected by meeting, greeting, talking together as a community. We love a lot of moving and going in groups and being in gatherings. That one has stopped, and those are the places where people could talk and express themselves and find their own problems and solutions. So as a community, people cannot do that because it is interfered with. There is no public gathering at all because of COVID. There's also mental instability, and people now cannot make decisions on a sober mind. So the person that maybe you saw as an enemy before, since you're not in a sober self, you might as well go back seeing them as a bigger enemy because of lack of a better way to express yourself. So people don't reason so well. So the enmity still continues among the communities because everybody is struggling to get what they should or they want. For example, in the northern side of Kenya, we have the cattle rustlers, people who are pastoralists, and there's a lot of cattle rustling in those areas. So right now, there is no soberness in thought and in mind. So guys are not stable to even think. So I guess the situation is worsening there. And there's also suicidal thoughts in homes. So people are just turning suicidal because of lack of work, lack of jobs. The guys have been fired from work, and a lot of businesses have ceased from being because of the restrictions of COVID. So those have brought suicidal thoughts and people having mental instability. There's also been financial and economic inflation. This has really slowed down in finances. Like the funds that a lot of NGOs and other non-governmental organizations and churches that would do, the activities they would do to help curb or bring peace or mediate communities and people, it's no longer happening because there's a lot of inflation. There is no money, there is no funds or any resources directed to that area. Guys are just trying to survive and stay alive. So there's no money that is directed to that side. So the financial part of it has brought a lot of slowing down in the processes, even in other parts of Africa. There's also been increased domestic violence. I had my friend there talk about it before, and I think I'll just touch on it just a little. On women and children and even men, there's a lot of domestic violence because of the whole confusion. Remember, I just said about some mental instability, and now people don't know what is happening. The uncertainty and the confusion in families now, narrowing it down to the families, is bringing a lot of domestic violence. There's no understanding in families. There's also the travel ban that within and without other countries. You cannot go to any other country. You cannot go to, you cannot travel within your own country. There's also the borders are closed. That one, before, people could move freely, and we could have people, even stakeholders from outside our countries and maybe neighboring countries, come in and help negotiate peace among all of us. But right now that one is really not happening. And even traveling within, like in Kenya, we have counties, so you cannot freely move from one county to another to just help the process of peace. So that one has really affected it. It has made it very hard. There's also limited resources. There is no resources that were being used. For example, I'll still use the northern of Kenya. They could get a lot of supplies in food supplies, water, and medicine. When they would gather and get those services provided to them, those were the best times to speak about peace and help mediate the people. But right now it is not happening. So it is even causing more havoc because there are no people going to even take the medicine and the food. And there's a lot of malnutrition, death from disease, and famine, which has come to both people and animals. And the dependency is now much. They depend on, there's no one to like help them like before, because people are afraid to travel and even contact and spread the disease. So that one has caused a lot of trouble more than good. It has caused harm more than good. There's also the closure of schools. Like in Kenya, we closed our schools for a very long time, and the children and the kids from the students in school, after staying at home for a very long time, going back to schools was crazy, because it's as if they were now different people. Trying to relate with the teachers and other students had brought it was now difficult because of the behavior change. There was a lot of behavior change in our children because they were used to a certain system, and the system was broken for so long. So they collected a lot of different behavior, and bringing them back to school in a class setup became very troublesome. There was a lot of fighting. There was a lot of they were even fighting teachers. We have cases in Kenya where teachers were stabbed by students stabbing each other, and there was a lot of war. Just it now goes back to the mental cases before, because there's no soberness in even the kids. I would also say that the COVID-19 has also affected positively. There are little positive impacts. I don't know if this is a good thing or a bad thing, but there have been COVID millionaires, people who have manipulated the systems and gotten rich over the time that they've been lockdowns and all that, by hiking prices of commodities to people and making life very difficult to people. But it has made them millionaires. So I don't know if it's a good thing or a bad thing anyway, but to the larger people, it has really affected and driven them to poverty. So it's both negative and positive to some people, depending on where you're looking at it from. And there's also been an increased use of technology, a lot of transaction of money, and a lot of information has gone to a technology part of it. So people have now embraced the technologies, that something that people are a little reluctant on doing, and people have kind of appreciated the technology. So I guess that is all I had for today. And thank you for listening and for my time.
Thank you, Elizabeth. That was really, really great, actually, making all those points about mental health, and specifically mental health in children is, I think, something that's probably overlooked quite a lot. It's not thought about as much as it should be. So looking at the next speaker that we could have lined up, I see that Faustina, who was another speaker that we had lined up, is in the group. Faustina, if you can hear me, would you like or be able to go next? There you are. Yes. Okay. Yes. Okay. You just need to unmute yourself. Very good. Okay. The floor is yours.
We can't hear you. You're unmuted now, which is great, but I think the headphones, I can't hear anything.
There we go.
Yeah.
There we go. Okay. Perfect. Okay, take it away. Yep.
I would like to present to you the impact of COVID-19 on the African women and the way forward. Like the rest of the world, Africa has been hard hit by the coronavirus disease, which emerged in the latter part of 2019. However, unlike the rest of the world, children in Africa are the worst hit, although not by direct fertility, but secondary impact. Every area of their lives, from things as basic as food to education, is being threatened. According to the Pan-African policy put together by Save the World in 2020, the COVID-19 pandemic has hit Africa not only as a health crisis, but also as a devastating socio-economic crisis that may persist over the months and years to come. According to an article published on their website titled COVID-19, a catastrophe for the children in sub-Saharan Africa, the UNICEF report that the sub-Saharan region is suffering from an economic recession. The region's first ever, causing about 500 million people into extreme poverty, and the majority of those affected being children. For the economy and the business. In the rural areas, women's involvement in farms have gone up in regions where there are shortages of labor due to decrease in the number of migrant workers. Aside helping their husbands in the farms, we have a lot of women who own some farms and have employed others to work on their farms. But due to the border closure, women farmers are working more extra to ensure the betterment of their farms, which is having a toll on their health and the care of their homes. We have others who are also into trading and businesses. It has also not been going on well as before due to the travel restrictions and closures of the borders. This have also bring financial constraints on many women in the formal sectors who depends on incomes and that are earned on daily basis from plying their trades and businesses. Some are even out of business since they have used their capitals to feed their families. We also have other women with various disabilities who are single parents. Things have been more difficult for them since the start of the pandemic. Some were into small trading, whilst others were not working but benefiting from others. Their plight need immediate attention since they have children and must feed as well as take care of their needs. Their conditions are not making those trading to continue because they know it's dangerous to their underlying health issues. Incidents and reports of violence against women in Africa within the household have also risen. This points to the male psychological distress due to the short-term loss of work and ages and subsequent violent behavior and or confinement at home with abusive partners during lockdowns. As a result, women's psychological well-being has been affected even more adversely than men from financial and emotional stress combined with physical violence. However, this period has also brought a lot of divorces, which is having more hardship on the women, since most often, whenever there is a divorce, children are being left with their mothers with a lot of responsibilities. These violent behavior has left some with physical effects and even death in some cases. The stress and the emotional pain affecting their mental health have made some women to commit suicide since they think it's the only option they have. Some are also facing a lot of health challenges like hypertension, diabetes, heart problems, ulcers, cancers, and a lot, but to mention a few. Many girls have also not been able to go back to school because of the financial constraints of their parents. There have been some changes in the educational sector due to the pandemic. The study of online demands more data, usage of smartphones, iPads, and laptops have been crucial because of the online studies, and buying of other educational materials have been burdened on mothers, especially the single mothers, and we have a lot in Africa. Those who have gained fresh admission could not go because of high fees and other demands by the schools. Due to that, most girls have gone wayward, which have resulted in teenage pregnancies, abortions, and even death. It has also led others into early girl-child marriages since their parents think it is the only means to get financial help for the family. But early childhood marriages will have a long-term effect on the African continent. The African community have been battling with early childhood marriages already. Many government leaders and NGOs have been trying their best towards combating to the latter. There have been some cases where house owners have been evicting tenants because they cannot afford rent because of the impact of the COVID-19. Crimes are also on the increasing since there has been no work and businesses are dying off. We have been victims of robbery. Women have been victims of robbery. Even just recently, an ambulance driver was shot whilst carrying a pregnant woman. The nurse and the sister of the pregnant woman were all robbed because of their belongings. And then many robbery incidents going on at where I even live. And the most pathetic of it is there are women robbers. Some women are doing a lot too, just to survive. With all the problems I have mentioned so far, as some impact on the women in Africa are concerned, I believe Global have come at the right time to help in solving some of these problems. Our governments are also doing their part to ensure the well-being of the African women. Global, as we stand for peace, knows very well that peace is very essential in every household, in every individual's lives. Based on the impact of the COVID-19 pandemic on the women in Africa, Global must run some virtual meetings with the women, assuring them not to panic, but to stay calm and focus as the government and the scientists are doing their best to bring back the normal environment that we used to have, even if not 100%, but to the level each and everyone can work safely. With the country's retrogression economy and capital being stranded, giving them financial assistance will be helpful and providing with some equipment and chemicals for farming as well. Skill training and development has also become very essential to entrepreneurs towards making them independent of themselves. Providing counseling sessions for those with marital challenges as well as the violated ones and those going through mental and emotional stress. A call-out phone must be provided and the number given to the general public to call and arrange with the counselors. That calls for a setup of counseling department immediately. It will save a lot of women from committing suicide and it will give them hope as they know they are not in it alone. Health screening and medical supply must also be provided from time to time to ensure their good health. Health insurance is now taking over the cash and carry system that the hospital used to operate, hence the need to support those who cannot afford the cost of registration. Supporting the girl child with scholarship and other educational materials will enable them to continue their education and to avoid being forced into early marriages, teenage pregnancy, etc. Supply of sanitary pads and other items that are essential for their daily use can also be looked at. If financial assistance is being given and trained with various skills, they can work and pay their rent and not to be evicted from their rented homes. Women crimes will also reduce with above initiative. Women with disabilities can also be supported with food aid and household items from time to time. In conclusion, as COVID-19 has come to stay with us, we all must stay safe with the adherence to all the protocols put in place for us. As the leaders and the scientists continue looking for ways in bringing the pandemic to an end. With all the impact that the women of Africa are facing, there's still a brighter future and a hope to hold on to. And that we all must get involved in helping the vulnerable ones and the less privileged in the society of Africa to inspire, to motivate, encourage, and to have meetings with them. If meeting in person are not allowed for now, talking to them and sharing with their problems will bring the light in many. I believe in time to come, we all will be happy on getting on board in helping the women in Africa by putting their smiles back in their life. Thank you for your time and listening to me.
Thank you for that, Faustina. I'm actually going to hand over the reins now to my co-moderator, Mac. Mac will take over the introductions of the next few speakers that we have lined up and yeah, take it all from here. So Over to you, Matt.
Hello, everybody. Okay, so next we have Joseph John Kohl. He's with the Global Peace Association of Ghana. Joseph, are you ready?
Yes, I am.
Okay, so the floor is yours.
Yeah, good afternoon, everyone. Hello.
Hello.
Hello, good afternoon.
Yeah, good afternoon, everyone.
Good afternoon.
Yeah, I would also like to share my view on the impact of COVID-19 on the peace processes in Africa. Of course, as soon as you talk about peace, you can never take away good health. So once health is affected, then it means that peace has issues. Peace is having its own confrontations. So definitely the global world is facing challenges as far as the peace process is concerned, and Africa is not exempted. I have some few points which I would like to also highlight on for us to know, and then take a critical look at as far as the peace processes in Africa is concerned. As the earlier speakers spoke about, and I also re-echoed, that the COVID started at the latter part of 2019 here in Africa, but not globally. Here in Africa, it started in the latter part of 2019. And it has negatively impacted on Africa as a whole. When you look at the level of crime rates, it has risen to the height of uncontrollable. For instance, here in Ghana, every blessed week, there is the possibility of an attack on police, attack on civilians, and it ends up killing and also robbing their properties. At the educational level, children are not going to school. Children are home. Some of them are supposed to use internet in learning. It's impossible here in Africa because the system of the IT is so bad. It's so bad to the extent that not all the communities are accessible to the networks. So it becomes impossible for them to learn, of which is also gaining negative impact on their academic records. Next on my list, you can also see the NGOs, civil society organizations, struggling to mobilize funds for the propagating of peace and its dynamics. It has become extremely difficult from the latter part of 2019 till date. Some organizations are not even able to rise up. But as far as you and I are concerned, you all know that without funds from donors, without funds from supporting groups, it's impossible for civil society networks like that of ours to, as it were, run its programs. Now, some of the African countries are such that they want to have their programs visibly, not to the extent that you do it virtual whatsoever. And these days, because of the embargo on public gathering, you are unable to organize such events where they could also learn something out to change their mental attitudes. So that's also another problem for us we are facing here in Africa. Then when it comes to the economy, yeah, globally, the entire economy is crashed down, let alone the struggling African economy, which was more of dependent on the Western world. So That is also another factor, and it has also compelled some people living in rented homes to be ejected because they are unable to pay their rents. Some of us were granted the permission to take water for free. We ended up paying for it starting from last month, and most people are not able to pay. By so doing, their taps are being shut off, and so forth and so forth. So in fact, when you talk about COVID-19, it has negatively impacted on Africa to the extent that we need to revitalize ourselves to ensure that all these things are being averted. When you look at domestic violence, it's also high on the increase because people are not able to take up their basic responsibilities as family heads, particularly the men. They end up being furious any little thing that happens in the home, and in the end up brutalizing the kids, brutalizing their wives, and so forth and so forth. So when these issues about the economy is fixed, definitely peace will stand tall as far as Africa is concerned. And more so, we also need to look at how best to make distributions as far as PPEs are concerned, and also the stimulus packages are concerned. The way and manner is being distributed, I beg to differ, is not the best here on our continent. Aside from that, they are unable to give us the accurate figures on the grounds, all in the view of making petty politicking out of it. But I'm not sure it's helping the entirety of the continent. Rather, it is benefiting some selective individuals who think they must rise to their political interest. So without much ado, I'll end my presentation here. So I wait for further questions to respond. Thanks so much for your attention.
Thank you, Joseph. That was very insightful. And our final two speakers are still not on. So
we hang on, we did just get one new one that entered, Elizabeth from Globag in Ghana. I believe I just admitted her, so maybe just we give her, there she is. Okay.
Oh, okay. Okay, Elizabeth, hello. Hello. Hello, Elizabeth.
It seems we might not. Oh, okay.
Hello. Yeah, hi. Okay, the floor is yours. You have 9 minutes. And welcome.
One thing we should mention quick is we have a translation feature. I believe Elizabeth will be speaking in French. So if you don't speak French, on the bottom of your screen, you'll be able to find where you can translate into English. It should be next to the green button on the right.
Bonjour.
Pauline, could you maybe just ask Elizabeth if everything's okay, if she's having any technical difficulties?
Oui, bonjour.
Je m'appelle Elisabeth.
Je suis Elisabeth Namoudou Maou, chargée de l'administration au sein de la PADOC en République démocratique du Congo, à l'Est.
Je ne sais pas si j'ai un translateur.
Je ne sais pas si j'ai un translateur qui peut traduire le français en anglais, parce que moi je parle français. Bien, merci. Je vais passer l'impact de Covid-19 et les conséquences en République démocratique du Congo, précisément en l'est du pays. À cela, je vais parler le contexte actuel du coronavirus. C'est le premier point. Le deuxième point, je vais parler sur les conséquences sur l'économie de ménage. Le troisième point, je vais parler des conséquences sur la vie conjugale dans le foyer. En ce qui concerne le contexte actuel du coronavirus, c'est depuis l'apparition de Covid-19 dans le mois de mars 2020 en République démocratique du Congo et en particulier au Sud Kivu. À l'arrivée de cette pandémie, le gouvernement avait mis en place des mesures pouvant aider à réduire la propagation du coronavirus. Entre autres, la restriction de... Entre autres, la restriction des mouvements de population d'un territoire à une autre, d'une ville à une autre, le port de masque, l'interdiction des rassemblements et le lavage de mains. Cette pandémie avait affecté les activités économiques et paralysant le revenu dans les familles et exposant plusieurs personnes à la pauvreté, particulièrement les femmes, car toutes les frontières avaient été fermées. La population frontalière vivait grâce aux importations et exportations de marchandises et servait à la population de paix quotidienne. Quand les mesures de confinement ont été levées, la population commençait à prendre le souffle. La deuxième vague du coronavirus est déclarée au mois de décembre 2020 en République démocratique du Congo, occasionnant la fermeture brusque des structures scolaires, académiques et toutes les frontières voisines de la République démocratique du Congo, remettant encore le compteur à zéro pour la population qui se recherchait. À ce qui concerne le deuxième point, des conséquences sur l'économie des ménages. Les fermetures des frontières ont provoqué la hausse de prix de produits et d'arrêts alimentaires importés de première nécessité. Dans le ménage, ceci a provoqué la malnutrition des enfants, des femmes enceintes, même aussi de personnes de troisième âge ont été pirement affectées. À ce qui concerne le troisième point, les conséquences sur la vie conjugale dans le foyer. Partant de la crise économique sans précéder que le Covid-19 a provoqué dans le monde, la vulnérabilité de femmes, de filles et des enfants en République démocratique du Congo en général et à l'Est en particulier, où les femmes sont souvent victimes des atrocités, des conflits intercommunautaires, des groupes armés, entre autres, les violences sexuelles, les assassinats et autres violations des droits de l'homme. Cette situation complique les femmes de subvenir à leurs besoins de ménage. Certaines femmes mariées, filles ou les veuves font recours à la débauche. Entre parenthèses, je peux dire que c'est une vente de sexe. Elles se font exploiter sexuellement par les hommes qui disposent de petits moyens financiers, pensant qu'elles puissent sauver la vie de leur famille, alors qu'elles sont à risque de maladies sexuellement transmissibles et la rupture de mariage. En outre, les conflits entre les femmes et leurs maris sont enregistrés dans le foyer, car les maris ne sont à mesure de différentes mesures de crainte décrétées par le gouvernement. En fait, aucune stratégie mise en place pour essayer de résoudre et réduire les conséquences de Covid. À ça, je veux donner des recommandations à ce qui concerne mon exposé. Mes recommandations, je peux dire que mettre en place de mécanismes et mesures pouvant réduire la vulnérabilité des femmes et des enfants face au risque de la propagation des maladies à coronavirus et autres maladies sexuellement transmissibles. Aux personnes de bonne foi et bonne volonté du globe et aux organisations caritatives de pouvoir venir en aide pour aider et assister les personnes et les femmes en difficulté. Aux organisations de droits de l'homme et de la paix d'accroître le cri de femmes africaines en général et en particulier de la République démocratique du Congo pour construire la paix. Je vous remercie, c'est Elisabeth.
Okay, merci Elisabeth. Merci à ton présentation, if that's right. Okay, so thank you for that. So we had a final speaker who's still not in yet. So
actually, we have our last two speakers just got on in the last couple of minutes. So we have both Freddie and Kohl in the room with us now.
Okay, Monsieur Freddie. Allô? 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 Allô?
Il paraît que le collègue a des difficultés, s'il peut utiliser
La mienne.
la mienne.
Oui, allô, allô, Pauline? Allô? Allô?
Allô?
Et allô?
Allô?
Allô? Oui, c'est Freddy Mwambikasongo. Oui, chargé de programme au sein de l'Association d'action de paix et de développement communautaire à PADEC. D'entrée de jeu, à l'Est et en particulièrement la République démocratique du Congo, au Sud Kivu, à Uvira et dans les hauts plateaux d'Uvira, Fizi et Itombwe. Cette partie du pays est confrontée par la crise des conflits intercommunautaires causés par les groupes armés locaux et caractère communautaire, mais aussi par les groupes armés étrangers en provenance de pays voisins. Cette crise a jeté les populations dans les lieux de déplacement selon les évaluations effectuées par les organisations internationales et nationales, dont la PADEC faisait partie, où il a été identifié 6 426 ménages, soit 32 130 personnes dans la zone de santé d'Uvira et 8 140 ménages, soit 40 700 personnes dans la zone de santé de Nundu en territoire de Fizi. Cette crise n'a pas épargné la province d'Ituri, Nord Kivu, à l'occurrence Beni, qui est devenu aujourd'hui l'abattoir d'hommes. Rutshuru et Masisi ne sont pas aussi épargnés par cette escalade de conflits et massacres des populations. La présence de Covid-19 et son impact sur la paix en Afrique et en République démocratique du Congo en particulier. Avant de parler ou d'arrivée de cette pandémie, à l'arrivée de Covid-19, la RDC était déjà bien avant attaquée par la pandémie à virus Ebola. Depuis le mois d'août 2018, le Nord Kivu, Ituri et Sud Kivu ont été attaqués par cette pandémie. Aurait fait la mort de 2266 personnes, au moment où la population prenait le souffle. En mars 2020, en République démocratique du Congo, s'est ajoutée encore une autre pandémie, la plus cruelle, le coronavirus, dont les records mondiaux restent effrayants, avec des effets qui paralysent toute la planète et qui a provoqué la fermeture de toutes les écoles et les infrastructures sociales dans le pays, mais aussi les frontières du pays voisin, provoquant et jetant un grand nombre de personnes dans le chômage. En décembre 2020, la deuxième vague du coronavirus est déclarée encore en République démocratique du Congo, provoquant ainsi la fermeture brusque de toutes les écoles et les frontières du pays voisin. Selon les observateurs faits sur la présence de Covid-19 en République démocratique du Congo et sur le confinement, il se remarque que ces mesures sont sanitaires pour réduire la propagation de cette pandémie. Mais néanmoins, cette pandémie a un impact négatif sur la paix et la sécurité en République démocratique du Congo et en particulier à l'est de notre pays. Après les fermetures de toutes les écoles, plusieurs jeunes ont abandonné le chemin de l'école et se sont ralliés aux groupes armés, augmentant ainsi l'effectif des groupes armés dans le milieu rural à conflit intercommunautaire et sans de déplacés se sont lancés dans le banditisme et la destruction des infrastructures sociales et économiques. Le secteur économique étant paralysé par ces mesures, certaines personnes vivaient au temps du jour et autres qui avaient des petits capitaux se sont retrouvés dans le néant, donc le mains vides. Le fait de manque de l'assistance dans les zones de déplacement où sont hébergées et concentrées plusieurs personnes confinées, les vulnérabilités de certains ménages les poussent à développer les banditismes dans les communautés, les vols de biens et bétail, mais aussi les assassinats ciblés dans les centres-villes à la recherche de vivres et de nourriture. Quelles recommandations avant d'atterrir ou déterminer et actions souhaitées à faire? Accompagner et soutenir les initiatives d'action humanitaire axées sur la consolidation de la paix dans les contextes des maladies pandémiques à Covid-19. Aux partenaires de tous les horizons d'accompagner les organisations de la société civile africaine dans les actions de consolidation de la paix parce que c'est un besoin plus urgent et important en RDC et en Afrique en général. Lever et rehausser le voix des organisations de la société civile africaine pour une cause commune de la construction de la paix. Ainsi, faite à Uvira le 31 mars 2021, présenté par Freddy Mwambi Kasongo, chargé de programme au sein de la
Presented by Freddy Mwambi Kasongo. Thank you for listening.
Merci pour la présentation. Okay, so I think that should be it. We have Freddy Mwambi. Has Freddy already spoken? Freddy Mwambi from Upper Deck. Hello, Freddy.
Allô?
Oui, allô, Freddy.
Oui, je suis en ligne.
Avez-vous déjà parlé?
Oui, j'ai parlé déjà. Je ne sais pas si vous m'entendez. J'ai exposé.
Oh, ok. Je ne pas sûr. Ok, merci. Okay, so
Vous n'avez pas bien suivi?
My French is rusty, but it had Elizabeth written, so I wasn't sure if it was Elizabeth or Freddie speaking.
It's a Freddie who came to speak now.
Oh, okay. On my screen, it was Elizabeth written there, Elizabeth Namudulo. So I was wondering.
Okay.
Oh, okay. So
he was using the laptop of Namdulu.
Oh, okay.
But it was Freddie speaking.
Oh, okay. Thank you, Freddie. Yeah. So I think we've exhausted all our speakers for the day, and we are moving on to our questions session. Hello. So we are moving on to our questions session.
I think we were supposed to finish now, so we might have time to go about maybe 10 minutes over. So probably 2 questions maximum we could take. Anybody who has a question, you can either write it in the chat, which is probably easiest, or you can also use the raise the hand function.
Yeah, hello, Stephanie.
Okay.
I think Innocent has the first question.
Yeah, it's not a question, but just to say thank you for the presentations. And the presentation shows or revealed we need some actions. So the recommendation to IBP family organization through this, by this presentation, you can have an action plan to work together to respond on those needs. Yeah, thank you. This is just a small comment.
Okay, thank you for the suggestion. Thank you. Any other question?
Hi.
I just realized that we have
Hello.
Paul never spoke. Also from Apotec in Ghana. So just it might be nice if we use the remaining time that we have left to give Paul the opportunity if you would like to. Otherwise, we can continue with questions. Kohl, would you like to speak, or would you like to just pass?
Hello. Hello.
Yes, Paul.
Yes, I'm ready. I'm ready to speak.
Okay, Paul, the floor is yours.
Thank you. Je suis Paul Boulango. Je suis le coordinateur de l'Association d'action de paix et de développement communautaire qui intervient en République démocratique du Congo. À l'Est, c'est dans la province du Sud Kivu. Juste ma présentation est focalisée sur les groupes de personnes vulnérables, spécifiquement les enfants et les personnes vivant avec handicap. Les observations majeures par rapport à la situation de l'enfant et les personnes vivant avec handicap. Sur l'enfant, cette propagation ou l'apparition de la pandémie a entraîné d'énormes conséquences sur les enfants et qui sembleraient être lourdes aussi bien pour les enfants car il y a eu les fermetures des écoles, réduction des mouvements et autres mesures préventives qui ne sont pas ou qui n'ont pas été respectées dans la région ou dans la zone. Et la fermeture des écoles et la réduction de ces mouvements a occasionné le risque de recrutement et l'utilisation des enfants dans les différents groupes armés locaux étrangers, ce qui accrue les conflits dans la communauté et qui affecte l'ensemble des territoires, surtout à l'est du pays. L'ignorance presque totale de l'évolution de ces mesures ou des réponses préventives faute d'inaccessibilité, les manques de communication et d'acteurs mandatés dans les zones, mais aussi les degrés de risque semblent plus pertinents si la pandémie arrivait à toucher ces zones des enfants victimes de violences intercommunautaires ou chroniques du fait de conflits armés et qui sont longtemps restés abandonnés à leur triste sort bien des années. Les mesures de la restriction des mouvements et confinement sont en caractère préventif, mais elles créent des conflits entre l'enfant et les services sociaux de base. Sur les personnes vivant avec handicap, depuis l'arrivée du Covid-19 en République démocratique du Congo, cette pandémie a engendré de multiples conflits, particulièrement dans des foyers de personnes vivant avec handicap et de multiples divorces enregistrés dans les foyers de ces derniers, car les capacités de subvenir aux besoins de leurs foyers familiaux ont été réduites. Ces personnes dépendaient avec de petites activités génératrices de revenus et autres activités commerciales en provenance de pays voisins, par exemple le Rwanda, le Burundi et ailleurs. Cependant, avec cette pandémie de Covid-19, la situation devient de plus en plus critique et inquiétante pour les personnes vivant avec handicap et autres personnes vulnérables. Cette situation entraîne les divorces et les conflits dans les foyers de ces derniers, car la capacité a été réduite et faible. Et les femmes sont exposées aux violences sexuelles pour la recherche de certains moyens de subvenir aux besoins de leur ménage. En février 2021, on avait dénoncé la réouverture des activités scolaires et le retour semble être au ralenti. C'est dans le pays parce que la deuxième vague de coronavirus a été déclarée en décembre 2020 et on a fermé brusquement les écoles. Et en février 2021, on avait déclaré la réouverture des écoles et que cette réouverture a été au ralenti. Et les candidats au test d'effet des cycles primaires se perdent dans l'inquiétude, l'incertitude et le traumatisme planent dans les esprits et les mesures préventives ne sont pas mises en place par les parents de ces enfants. Aucune mesure sociale palliative mise en place par le programme de riposte pour suppléer aux besoins vitaux des enfants et des personnes vivant avec handicap, pourtant faisaient des bulletins de temps de jour de leur famille. Du fait des manques de programmes de riposte multisectoriels, dans la plupart de nos zones, au niveau des acteurs, la vulnérabilité des enfants et des personnes vivant avec handicap s'accroît et développe des délinquances juvéniles et le banditisme pour des enfants et séparation de certains foyers pour les personnes vivant avec handicap dans les communautés. Certaines recommandations, c'est avoir ou trouver certaines personnes de bonne foi, des organisations qui interviennent, des donateurs, qui interviennent dans la paix et la protection pour les activités de consolidation de la paix et de la protection. Mais aussi avoir des appuis, avoir un appui de prendre en compte tous les secteurs de vie des enfants et des personnes vivant avec handicap pendant cette situation de coronavirus ou Covid-19. Merci, ça a été présenté par Paul Boulambo, le coordonnateur de l'APADEC, Association d'action de paix et de développement communautaire en République démocratique du Congo. J'ai dit et je ferai merci. Thank you.
Thank you, Paul. Merci.
Good.
Yeah, thank you. At this point, is there anything anyone would like to suggest, ask, anything?
We have we have one raised hand from Felix. Felix, we will only have time to take your question, and then after this, we need to wrap it up.
Hello. Good afternoon, everyone. Do you hear me?
Yes, you can speak.
I'd like to thank the panelists who gave us these ideas. I thank the programmer of this meeting, the initiator. My name is Felix. I live here in Kigali, Rwanda. I work on local NGOs called Technical Action for Community Development. The impact of COVID-19 has been shown in many areas here. We work with rural areas by providing good education to the kids and by providing housing for the rural communities. Because of the COVID-19, we didn't access to those areas because there was lockdown here in the province and in Kigali cities, and there was big issues to reach those people in those areas, and there was the financial problem. The donation of the funds to reach those peoples. I'd like the I would like to advise the organization to, international organization to provide for African country the funds to invest in those areas, in rural areas here in Africa, because COVID-19 has main impact to our communities. The children were at home, there was sexual abusers, there was alcohol abusers in the communities because people were in their house, not the means, not the money, and there was not anything for interaction like sport. Everything were closed, and we hope that working together with internationally, to the international level, we hope that something will help Africa to come up with peace after the COVID-19. Thank you very much.
And thank you very much too. So all too soon, we've come to the end of our session, and it was very insightful and educative. Would like to say thank you to all of our panelists. We are very indebted to you for all that we have learned here today. Would like to say thank you to the International Peace Bureau for putting all of this together, and to the technical team, to all of our participants. We say thank you to our French brothers. We say merci à vous. And we look forward to equally interesting webinars. And yeah, so right now we are hoping for a more peaceful and safe environment, even in these times of COVID-19 pandemic. Thank you all for making this program successful. Merci à vous.